Hi everyone, Dr. Hatami is here. In this video, we're going to talk about the kidneys. Kidneys are the primary organ of the urinary system. These two amazing organs in our body. So kidneys are bean-shaped and they would be found in our abdominal cavity, which these are called as retroperitoneal organ. What does it mean, retroperitoneal organ? If you remember, peritoneum is a serous membrane covering the organ of our abdominal pelvic cavity, like our stomach, small intestine, spleen. They will be covered by peritoneum. Then retro means back or behind. So kidney is the organ would be found behind the peritoneum. That's the reason we call this as retroperitoneal organ. Retroperitoneal organs are deep organs, which means that you can find them in deep part of the abdominal cavity. Let's take a look at this cross section of our abdominal cavity. So as you can see, this space is showing the peritoneal cavity, which the organs has been removed. And then here you can see the parietal layer of a serous membrane. And then the kidneys would be found just behind the peritoneum. So here we have our right and left kidney, which as you can see, they would be found on either side of the spine or vertebral column. If you draw a line passing through the superior and inferior border of the kidney, kidney would be found between the vertebrae T12 to L3. That is a picture that you can see from behind. That is a posterior view of the body. So here we have our right kidney and here we have our left kidney. So as you can see, our right kidney is lower than the left one, which is actually normal. So the right kidney is slightly lower than the left side. That's because we have the liver in the right side, which the liver is the largest organ in our body. It's going to occupy the most part of the right upper quadrant. So that's the reason, because we want to have like a more space for the liver, our right kidney normally is slightly lower than the left side. Kidneys are very important organs. We talked about the kidneys function in another video, but they should be well protected. So they're going to be protected by our rib cage, specifically our rib number 11 and 12, going to cover or protect our kidneys. And also there are some fat tissue, the connective tissue covering the kidney to protect them. As you can see in this picture, the kidney is going to receive fresh blood from the renal artery and then is going to send out deoxygenated blood from the renal vein. And there is another structure coming out of the kidney which is called ureter. Ureter is going to transport urine from the kidney to the urinary bladder. Now let's cut the kidney and take a look at inside of the kidney. This amazing organ. We actually can divide the kidney into three parts. The outer region, which is the superficial region, is called the cortex. So here, let me just color it with blue. So this part is called the renal cortex, which is the superficial region. The term renal means kidney. So for example, we have renal artery, renal vein, renal cortex. Then the inner region or the deep region, which is here, is called renal medulla. So far, we talked about the renal cortex and the renal medulla. Then, after renal medulla, this region, which is this funnel-shaped structure receiving the urine from the renal medulla and would be continuous with the ureter. So here, this is called renal pelvis. So one more time, we divided our kidney to these three regions. The outer region or the superficial region is called renal cortex. The deep region is called renal medulla. And then after renal medulla, we have this funnel-shaped structure is called renal pelvis, which after renal pelvis, the urine would be collected and transported by our ureter. Okay, so then in the renal medulla, we can find these two structures. This is the cone-shaped structure, which each is called renal pyramid because it's like a pyramid shape. So each of these cone-shaped structure is called the renal pyramid, like this. And then the renal pyramid or this cone-shaped structure, at their apex, there are some holes or opening, which is called renal papillae. So here we have the renal papillae, which then urine gonna pass through this opening and fill the renal pelvis. Okay, and also we have something else in the renal medulla. Look at here. The cortex of the kidney is going to invaginate into the renal medulla and would be found between our renal pyramids and making this structure as is called renal column. So here we have our renal column. So it means a renal medulla is composed of renal pyramid and renal column. So all of these together would be called as renal medulla. Okay, and let's take a look at the renal pelvis. So the renal pelvis, as I mentioned before, that is a part is going to collect the urine from renal medulla, but we can find some like little cup here which would be found like toward the apex of the renal pyramid or toward the renal papillae, which each of these little cup, which is going to receive the urine directly from our renal medulla, is called minor calyx. And then minor calyces join together and make this bigger cup, which then each is called major calyx. So that's the reason we can see minor calyx and then major calyx in the renal pelvis. Okay, so then let's review together. We talked about the capsule of connective tissue, which is going to cover the kidney from outside. Then we divided the kidney to the superficial region. The outer region is called renal cortex. Then the renal medulla, which is the deep region of the kidney, composed of the renal pyramid and renal column. So renal pyramid is a cone-shaped structure in the medulla. And renal column is the extension of the renal cortex in medulla between the pyramids. And also we talked about the renal papillae, which are the opening at the tip of the pyramid. And then we also talked about the minor calyx and major calyx, which this part would be found in our renal pelvis. So the minor calyx is going to collect the urine from the renal medulla, and then major calyx, it would be formed by fusion of 4 or 5 minor calyces. So then major calyx and minor calyx together make the renal pelvis. So then we can say the renal pelvis is a funnel-shaped structure collecting urine from major calyces directly and continuous with the ureter. And if you take a look at this picture one more time, there is a depression in the medial border of the kidney, which is called renal hilum. The renal hilum acts like a gate, which the renal artery going in, renal vein going out, nerves coming and going, and also ureter is going to leave the kidney through the renal hilum. Now it's time to draw and label the internal anatomy of the kidney to learn better. Okay, let's start with the outer region. Do it with me. So the outer region is called what? Renal cortex, right? Okay, so I'm going to separate this part and name this as renal cortex. And then for the medulla, which is gonna be this portion, the inner portion. And at the inner portion, we are going to make some cone-shaped structure, something like that. Around 10 to 15 of these cone-shaped structure would be found here in the medulla, which each is called what? Renal pyramid, right? Because these are cone shape. So here, like a triangle or cone shape, which their tip or apex would be toward the renal pelvis. So here, let's call this as renal pyramid, which their apex is called renal papillae. And also do not forget to send some of these cortex between the renal pyramid. And this cortex between the renal pyramid is called renal column. Okay, so then here we have our renal column. So then renal column and renal pyramid together would make our renal medulla. So means here to here will be the renal cortex. And then this part would be our renal medulla. So far so good? Okay. And then finally, the last part, which is composed of the minor calyx, this cup-shaped structure. Let me just use another color to like see it better, easier. So that little cup is called the minor calyx, which as you can see, they are here to collect the urine directly from our renal pyramid. Okay, so then as you can see, some of these renal calyces join together and make a bigger one. So each of these little one is called minor calyx. Calyx is the single word, calyces is the plural, and then here we call this as major calyx when some of these minor calyces join together, and together minor calyx and major calyx would be called as renal pelvis. Okay, and also do not forget to find these structures going in and out of the kidney through the hilum, which here we have our renal artery. Pay attention to the direction of the blood. This blood is oxygenated blood, but unfiltered blood because they're coming to the kidney to be filtered. And then here we have a renal vein, vitrinal vein carrying the oxygenated blood from the kidney, but it is filtered blood, which means that we remove the like waste products and toxins from this blood. And also here, let's label this as ureter, which the ureter is going to carry the urine from kidney to the urinary bladder. Okay, so hopefully you find and you learn the structure of the kidney, where it's located, and what would be the internal structure of the kidney. And thank you so much for watching.